Post-operative wound care is an important part of preventing surgical site infections. The process of wound assessment, cleansing and care must address the patient's needs and limit additional infection risks. The aim of this procedure is to protect the surgical incision and promote wound healing. Essential requirements for appropriate wound care are: 1. Routine checking of the surgical site, observing for any signs or symptoms of infection. 2. Hand hygiene before and after performing wound care activities. 3. Maintaining an aseptic or non-touch technique using sterile dressings. And 4. Prompt sample collection if a wound infection is suspected. It is also important that we educate patients on signs and symptoms of potential infections as well as personal hygiene. We can protect our surgical patients from potential infection through action.
Introduce yourself to the patient and explain the details of the procedure that you will be performing. Before beginning, be sure to address any concerns the patient might have. Perform hand hygiene before touching the patient. Then expose the wound dressing by adjusting the sheets and patient's clothes. The trolley surfaces and legs must be cleaned with clean warm water and detergent, then disinfected using alcohol or another non-corrosive disinfectant. Prepare the trolley by attaching a waste bag for waste collection. Then continue adding sterile field or tray, sterile swabs or gauze, sterile pack that includes forceps and container, sterile saline, sterile and non-sterile gloves, wound dressing and adhesive, alcohol-based hand rub. Place a sterile tray or cover over the top of the sterile field. If specimen collection is anticipated, a specimen collection bottle or pot and specimen swab should be included on the trolley. Once this material has been gathered, proceed to the patient's room. Perform hand hygiene before performing a clean aseptic task and don non-sterile gloves. Gently remove the used dressing. Careful to avoid touching the wound directly. Dispose of the used dressing and gloves directly in the waste bag. Perform hand hygiene after body fluid exposure risk. Carefully examine the wound and surrounding skin, noting the presence or absence of any signs of infection, inflammation, or other complications. If the wound is dry and healing, and there are no signs or symptoms of infection, no additional dressing is required. The patient can be instructed to shower as normal. If any discharge or other signs or symptoms of infection are observed, a doctor and/or wound specialist should be consulted. If an infection is suspected, any leaking fluid or specimen swab should be collected. Perform hand hygiene before a clean aseptic task. Open the sterile pack without touching the interior or sterile instruments. Empty the sterile forceps, scissors and container onto the sterile field very carefully. Dispose of waste directly into the waste bag. Pour the sterile saline directly into the sterile container or pot. Perform hand hygiene before a clean aseptic task and don sterile gloves. In this video, sterile gloves are used as the nurse will be reaching within the sterile field. Using sterile forceps, carefully manipulate the sterile gauze before soaking it in saline. Then turn to the patient and cleanse the wound, maintaining an aseptic clean technique. Do not repeat already cleaned sites or touch other areas. Immediately dispose of the swab in the waste bag. Using the cotton tip swab from inside the specimen bottle, carefully swab the fluid by going as deep as possible into the purulent wound. Cautiously place the tipped swab inside the specimen container and seal tightly. If there is enough fluid leaking from the wound, preferably use a clean, dedicated pot for its collection. Once the sample has been collected, proceed with routine wound cleaning following the same procedure. If the wound is not fully healing by primary intention, or the wound is potentially or confirmed infected, then a new dressing should be applied as follows. Using a new set of sterile forceps, carefully place the sterile gauze directly onto the patient's wound. Then measure the required adhesive based on the size of the wound and apply over the top of the wound. This type of sterile, non-adherent, pre-prepared dressing is more appropriate to optimize wound healing if available. Dispose of all items accordingly and remove gloves. Perform hand hygiene after a body fluid exposure risk and after touching a patient. Hand washing with soap and water is recommended when hands are visibly soiled with blood or other body fluids. Explain to the patient that the sample will be analyzed and results shared when available. Encourage the patient to report any discomfort or other potential signs and symptoms of infection. Push the trolley back to the preparation area and clear it as soon as possible. Record all observations and dressing change procedure in the patient's chart. If a sample was collected, ensure that it is correctly labeled and send it for analysis. If any breach in the aseptic technique or contamination of the outside of the swab pot occurred during sample collection, don non-sterile gloves or clean the outside before handling.